Wellness Rhythm Show. Find your rhythm. Live your wellness.
Y'all, quick question. When was the last time you thought about your mouth as part of your overall health? Not just cavities and bad breath, but actually connected to your heart, your brain, your whole system?
Right. Here's what stopped me in my tracks. The American Heart Association has published research linking gum disease to a significantly elevated risk of cardiovascular disease. We're talking about your gums having a conversation with your arteries.
That is not what I expected to learn on a Tuesday.
And here's the thing. The mouth is genuinely one of the most information-dense parts of the human body. Inflammation there doesn't stay there. That's what we're unpacking today.
So let's just set the stage. When most of us think dental health, we're thinking, okay, brush twice a day, see the dentist, maybe floss when we remember.
Which for many people is the night before the dental appointment.
Guilty every single time. But this is bigger than that, right?
Significantly bigger. The mouth contains over 700 species of bacteria. Most are harmless or beneficial. But when the balance tips, due to poor oral hygiene, stress, diet, certain bacteria trigger chronic inflammation.
And chronic inflammation is basically the villain of the entire wellness story.
That's precisely it. Dr. Stephen Offenbacher at the University of North Carolina spent decades establishing what researchers now call the oral systemic connection. The basic concept is that your mouth is a portal. What happens there can influence systemic inflammatory responses throughout the body.
So let's go deeper on the heart connection, because I think that's the one that genuinely shocks people.
Right, so the leading theory is twofold. First, periodontal bacteria, specifically strains like Porphyromonas gingivalis, can enter the bloodstream through inflamed gum tissue. Second, the body's immune response to that bacteria generates systemic inflammation that can contribute to arterial plaque formation.
Which is the thing that leads to heart attacks and strokes.
The research isn't settled enough to say gum disease causes heart disease, but the association is strong and consistent. A 2019 meta-analysis in the European Journal of Preventive Cardiology found people with periodontitis had significantly higher cardiovascular risk markers.
Here's the thing, though. I feel like nobody is connecting these dots for regular people. Your cardiologist and your dentist are not in the same building. They're not calling each other.
Almost never, and that's a genuine gap in how we approach healthcare systemically. Dentistry has historically been siloed from medicine, which is genuinely strange given the evidence.
Okay, so who else should be paying attention beyond heart health?
Diabetes is a huge one, and the relationship is bidirectional. People with poorly controlled diabetes are more susceptible to gum disease. But gum disease also makes blood sugar harder to control. It increases insulin resistance. The American Diabetes Association now explicitly includes periodontal care in diabetes management guidance.
Bidirectional means it goes both ways. So if you have one, you're more likely to get the other. And each makes the other worse?
Exactly. It creates a genuinely difficult feedback loop, and it's worth flagging for anyone in our audience managing prediabetes or supporting a parent with type 2. This is not a trivial connection.
And then there's the brain piece, which honestly is the one that keeps me up at night.
Right, so this is newer territory but compelling. Researchers at the University of Bergen in Norway published findings suggesting a link between Porphyromonas gingivalis, that same bacteria we mentioned, and Alzheimer's disease. They found the bacteria in the brain tissue of Alzheimer's patients.
That is genuinely unsettling.
It is, though I want to be clear, this is an association, not a proven causal pathway yet. The research is still developing, but it has enough credibility that there are now clinical trials exploring whether treating gum disease slows cognitive decline.
So here's where I'll push back a little, because I don't want people spiraling. This can start to sound like, if you didn't floss in your 20s, you're doomed.
That's a fair challenge. The evidence points to chronic, long-standing periodontal disease as the risk factor, not an occasional missed floss session. And crucially, gum disease is largely preventable and treatable.
That's the more useful frame. This is actionable. Okay, let's talk about what people can actually do, because that's why y'all are here.
The baseline is honestly well established. Brush twice daily for 2 minutes. Most people brush for 45 seconds, studies show. Use fluoride toothpaste. Floss or use an interdental brush daily. And see a dentist for professional cleaning at least twice a year.
And I know some people are thinking, I haven't been in 3 years. This is making me anxious. That's not a reason to avoid it. That is exactly the reason to go.
Precisely. Periodontitis is largely reversible in its early stages. Dentists and hygienists are not there to judge. They're there to reset the baseline.
Now, if we want to go beyond the basics, tongue scraping, oil pulling, these have gotten a lot of attention in wellness circles. What does the research actually say?
Tongue scraping has genuinely decent evidence behind it. A Cochrane review found it modestly reduces volatile sulfur compounds, the bacteria that cause bad breath. It also reduces overall bacterial load on the tongue, Nothing dramatic, but a meaningful addition.
I actually started doing it and I cannot believe the difference. Like your morning mouth is a different situation.
Oil pulling, typically coconut oil, swishing for 10 to 20 minutes, has some evidence for reducing certain bacteria and improving gum health markers, but the quality of studies is lower. The Indian Journal of Dental Research has published supportive findings, but the research base is thinner than the Instagram presence would suggest.
That is the most David sentence you have ever said.
I stand by it. The thinner the evidence, the larger the social media footprint often.
Okay, real talk. And this is where I want to disagree slightly. I think sometimes in wellness, we dismiss things because the studies aren't randomized controlled trials. But people have been oil pulling for literally thousands of years in Ayurvedic practice.
That's a fair point. Traditional use isn't nothing. I'd say low risk, potentially useful, reasonable to try if it appeals to you. Just don't replace the evidence-based practices with it.
I can live with that. Complement, don't replace.
Exactly. And speaking of complement, diet is significant here. Sugar feeds the bacteria responsible for both cavities and gum disease. But the nuance is that it's frequency of exposure, not just quantity. Sipping a sweet drink all day is more damaging than consuming the same sugar in one sitting.
I did not know that. The sipping thing is genuinely new information for me.
And anti-inflammatory foods, omega-3 fatty acids, green leafy vegetables, vitamin C, actually support gum tissue health. Vitamin C deficiency specifically is a well-documented contributor to gum deterioration. The journal Nutrients has published several strong reviews on this.
So the anti-inflammatory eating we talk about on this show keeps showing up everywhere. It's almost like the body is trying to tell us something.
Remarkably consistent pattern, yes.
Hey, before we go further, if you are finding this useful, please hit like and subscribe wherever you listen. It genuinely helps us reach more people who need this kind of practical, evidence-based conversation. We appreciate every single one of you.
Truly, right. Let's address the skeptics. Because someone is thinking, my dentist has never mentioned any of this to me. Should I be concerned?
Honestly, valid. I think a lot of dentists are focused on the teeth, not the systemic picture. It's worth asking your dentist directly, especially if you have a family history of heart disease, diabetes runs in your family, or you're noticing gum issues. Ask them to look at the full picture.
And for anyone in the sandwich generation caring for aging parents, oral health in older adults is genuinely underattended. Dry mouth from medications, reduced mobility making brushing harder, less frequent dental visits, these compound over time.
That is such a good point. My mom, I need to have this conversation with her, actually. We talk about her heart health, her diet. We have never once talked about her gums.
It's one of those invisible risk factors, easy to overlook because we don't connect it to the bigger picture.
Until now, hopefully. Okay, so if you take one thing from this episode, book the dental appointment. That's it. If you've been putting it off, today is the day. Because your mouth is not a separate system, it is talking to your heart, your blood sugar, potentially your brain. And the intervention is so accessible.
And while you're at it, 2 minutes twice a day. Studies consistently show that's where most people are falling short. And it costs nothing to fix. Brush for the full 2 minutes. It is a remarkably small investment for what the evidence suggests it protects.
Y'all, we genuinely love doing this. Thank you for spending time with us. And please do like, subscribe, share this one with someone you care about. Because this is the kind of thing that changes how you think about something you do every single day.
We'll be back next week. In the meantime, floss. Not just for the dentist, for your arteries.
Only David could make flossing sound urgent and slightly ominous. Take care, everyone. This show is part of the VoxCrea.AI system. If you want a show like this for your organization, without building it yourself,
go to VoxCrea.AI and request a sample episode.